Hi guys. So I am doing my presentation on the West Africa Ebola outbreak from 2013 to 2016 and the response of the World Health Organization to that outbreak. And it's been an interesting project to do because of the coronavirus pandemic and a lot of the overlap that I've seen between the response of the World Health Organization to each of these epidemics and lessons that were learned, and also lessons that were really not learned. This is my poster, and I'm not going to go into too much detail about it right now because I'm going to touch a lot of these points throughout the presentation. But basically the outline of it here, I have the event, the responding agency, a response chronology, and then also the post-disaster action, and just implementation of different measures to make sure that the world is more resilient for another outbreak like Ebola. Is that true? I don't know. It's hard to tell right now, and it doesn't feel like it. So what is the World Health Organization? It is an agency of the UN that was established in 1948, and it was given the mandate of protecting international public health. So the World Health Organization is kind of the world leader in ensuring public health, and there are a lot of countries that have signed documents that require mandatory reporting if there are public health incidents in their country to the World Health Organization. And so they have a lot of data points on what's going on in the world, and that makes them kind of the leader and the coordinating agency. So the World Health Organization has a lot of street cred, as it was instrumental in the eradication of smallpox, polio, and a variety of other diseases, who has international respect and trust because of their history. So WHO has the stated purpose of it in its constitution of attaining the highest possible level of health for all people. And it is this stated purpose that motivates them to be involved in global health crises, including the West Africa Ebola outbreak. So the West Africa Ebola outbreak occurred, it started in Guinea, and then it spread to Sierra Leone and actually had the most devastating impact on Liberia. And there are a few factors in these countries that made West Africa particularly vulnerable to the spread of such a horrific disease. The first is poverty. You can see the picture in Sierra Leone there of a slum. Even though these countries aren't necessarily the poorest in the world, there still is a lot of poverty, people living in close and unhygienic conditions that are conducive to the spread of Ebola. The second are dysfunctional healthcare systems. So below you can see pictured an Ebola treatment center in Sierra Leone. It's a very sophisticated medical establishment. And for a country that is poorer, it's an impossible standard to have these kinds of medical resources. So yeah, dysfunctional healthcare systems. Third, armed conflict. In 2013, there were a lot of internal wars and clashes in Guinea, and that is where the virus started. So violence and poverty and bad health are often lumped together, and that contributed to the spread of Ebola. And then finally, unsafe burial practices led to the spread, which were practiced in all three countries and involve sometimes kissing and a lot of handling of the dead body, and even in some circumstances, actually drinking the water of the waste materials that the body was washed in as a sign of respect to the deceased, which obviously is really bad for the spread of disease. So a little bit of background on the outbreak. It originated in Guinea. There were a total of 28,000 cases, 11,000 deaths, for a total fatality rate of 40%. Of the people who died, many of them were medical professionals, with 500 medical professionals losing their lives. And that's something that we're seeing with the coronavirus right now as well. Many of the deaths and just the cases are of people who are on the front lines and treating those with the coronavirus. The final case was found in Liberia in January of 2016. And so some of the issues that exist even to this day are the stigma of having been an Ebola victim, and then also post-virus health complications that exist. And so whose priorities are no longer on response to the outbreak itself, but really just being there to support victims and everything that they go through post-disaster. So the WHO response timeline. In December of 2013, we had the initial case of Ebola in Guinea. WHO was not notified of any cases of Ebola until March 2014, at which there was a report brought to the organization that this was one of the most intense Ebola outbreaks that the world has ever seen. And yet the World Health Organization, while sending in some teams to research the disease, really didn't do anything. They didn't declare a public health emergency until late June 2014. And then they didn't initiate phase 1 of the response until August 2014. So you can see from December to August, 8 months have passed before any intensive response began. So from August to December 2014, phase 1 began, and this was just aggressive treatment of all of the Ebola cases that were out there, and just trying to get a handle on the out of control epidemic. January to July 2015 launched phase 2 of the response. And this was really trying to gain community support and involvement, doing a lot of work on contact tracing here and making sure that anyone who had contact with anyone who had Ebola was collected and tested so that transmission chains were not just floating around. In July 2015, something instrumental happened. A trial vaccine was developed. This vaccine was actually not even approved until recently, 2019, and it has been determined to be very effective at preventing the Ebola virus. And so these were distributed beginning July 2015 on a mass scale and were very important for cutting off all transmission chains. August 2015 launched phase 3 to cut off transmission chains and really get a lot of community involvement, hand washing efforts, et cetera, to make sure that even though they had a handle on this, there was not a big reemergence. In December through January 2016, all 3 countries had their final cases of the Ebola virus disease. And in June 2016, so 6 months after the final cases, there was a G7 summit meeting that reviewed the World Health Organization response to the Ebola virus disease. And I'm going to go over some of those takeaways from that meeting in the next slide. Post-outbreak, there was a transition to survivor care and building resilient healthcare systems that hopefully will not crumble in the face of another Ebola outbreak in the future. So there are reflections from the G7 meeting. There's a need for rapid research and development, especially in just figuring out what this disease is, how it spreads, potential vaccines, etc. We're seeing the second takeaway from the coronavirus right now. There's a need for fast test turnover. There's a need for vaccinations, and so doing research and quickly developing those. The disease does not end just because it's left someone's body. There's a need for survivor support. And then finally, community engagement at the heart of the response. People need to buy into everything and really believe and trust the international aid community that's there, that this is a serious epidemic to handle. And we saw that in West Africa. There were a lot of people, even towards the end of the outbreak, that didn't even believe that Ebola was real. And we're seeing similar conspiracy theories right now with the coronavirus. So there were there's a development of some key resources, including a contingency fund for emergencies that WHO created. So this is just a pool of money that exists in the case of epidemics to kind of ease the financial burden for countries going through something that's expensive and a health emergency program. And so this was just a protocol for treating epidemics in the future. So I had an interview with Peter Deslouvier, a WHO spokesperson in Liberia from September to January 2015. The most profound thing from this meeting is that he talked about being at a home of an Ebola victim who had just died, and he watched the family call the ambulance. And when the ambulance came in, the family couldn't be anywhere near the dead body. It was sprayed, it was placed into a bag, and then carried away to be cremated. The family was devastated. They didn't want the body to be cremated, but they had no choice in the matter. And so there was a strong sense of anger and powerlessness and helplessness. Even though they call them safe and dignified burials, the burial is not done the way that the community wants it to be done. And so there is a sense of loss and sadness there. Okay, that's all. Comment your questions.